After a meniscus tear, it sort of depends on how much the meniscus was torn and how much was either taken out or repaired. In younger people, typically under 20 or 30, they tend to do, we think for the long term, do better with the repair because it keeps more of the meniscus, which is really important for the long-term health of the cartilage in the joint. So a repair generally, because something has to heal, it takes a few months, usually 3 or 4 months for that to heal, and the rehab is much more extensive. If it's just a small tear and the torn portion is trimmed out, usually the recovery from that is, 6 to 8 weeks or so with rehab, because nothing really has to heal. Just mainly the knee needs to be strengthened again and used to activity again. If it's a small tear, if it's a small tear that's trimmed out, the chances of re-tear are, we don't see that very much, it doesn't seem. Tears that are repaired, because the meniscus has somewhat of a limited capacity to heal, those sometimes will re-tear. Generally less frequently in younger people because their capacity to heal is better, but they can re-tear. But for the long term, 10 or 20 years from now, it's probably better to have as much of your meniscus as you can. Most of the time after meniscus surgery, especially young people, tend to have a full range of motion as long as there's nothing else wrong with their knee. If their ligaments are okay, their cartilage is okay, the prognosis tends to be very good for return to activities. It really depends on the injury. Something small like a meniscus tear tends not to have a big long-term effect on them. A more major injury like a fracture, especially to a growth plate, can have implications to future growth and to the long-term alignment of the joint and things like that. Depends on how big the injury is. Some of these are very high energy injuries and can have implications. Probably really depends on the injury. Some of the ACL injuries that go along with falling from big heights, and some of these really high energy injuries involve a lot of the ligaments in the knee. For example, it can be almost a knee dislocation where you have multiple ligaments injured or even fractures that are associated. So to some extent it kind of depends on how extensive the injury was. We try not to think of the ACL as being a career knee injury, but in some cases it can be. It really depends on the amount of damage of some of the surrounding structures that go along with the original injury. Well, one of the things with adolescents, it really depends on how much growth they have remaining. And in the adolescents typically have open growth plates, meaning the growth centers in their tibia and their femurs are still contributing to the length of the bones. And so in traditional ACL surgery, you drill across those growth plates, and which can potentially, at least theoretically, lead to some problems with growth and with the growth plate growing more on one side than the other or shutting down completely. And so it really depends on the amount of growth remaining. So really younger adolescents are probably better off with some of the pediatric techniques that we use to protect the growth plates and to go around the growth plates rather than go through the growth plates. Older ones that are approaching skeletal maturity in general get an adult style operation that's a more traditional ACL surgery that we don't worry as much about growth problems with them. Well, I think with, in general, a lot of, you see almost everybody wearing helmets these days, and I think helmets can prevent a lot of head injuries, especially for people that ski in the trees and kind of in the backcountry. As far as snowboarders go, we see a lot of wrist injuries from snowboarders because obviously they fall on their two hands, and wrist guards and wrist protectors are very helpful in preventing some of the snowboard-related wrist injuries that we see. As far as the ACL, commonly injured ligament in the knee, we don't really know a great way to prevent injury to that. Bracing doesn't seem to make much difference. Probably preseason conditioning and just being in shape and having strong muscles and skiing with the proper form and knowing how to fall correctly are the best things you can do for your knees.